Interviews are a really common part of medical training and in a GP practice context can provide a good opportunity for you to show how your skills, background and interests can align with the practice. And also to work out if the practice is a right fit for you and meets your needs. So preparing yourself can help you do well in an interview. Some things that you can do to help with preparation. Firstly, make sure you research and look up the practice so that you can tailor your answers to the interview questions to its patients, services, and team. So that might include, for example, looking at their website and speaking with past GP registrars who've been placed there before. Make sure you review the application that you submitted to the practice because they might have some questions about what was included in that application. Ideally, practice answering some common interview questions with others. And at the time of the interview, just be ready for general questions. And that might include questions regarding your professional goals, interests, and even clinical scenarios. If you are later in your training, you may also get asked about your future plans when you reach fellowship. Ideally, make sure you have confirmed the interview logistics, so the time, the location, parking, contact details beforehand, and make sure you arrive on time or ideally 5 or 10 minutes early. So think about how you present yourself, whether that's online or in person, because joining a primary healthcare placement is about joining a team and a community. On the day, make sure you listen really carefully to the question and answer clearly. So if you're feeling a little bit nervous, take some deep breaths to try to calm yourself. And if you need to, take some time to ask for a moment to think about your answer before you give it. If you're interviewing face-to-face, the interview really starts when you first walk in the practice door and say hello and introduce yourself to the receptionist, because they will often give feedback to the supervisor based on how you greet them. Practices want to see patients return to you, so your demeanour, your ability to communicate and relate to all different types of team members and patients is often a factor that practices are thinking about when they employ you. And if you don't yet have much prior GP experience when you're interviewing, that's okay. Use hospital experience as a reference. You can expect that as part of the interview, the practice will likely outline the supervision, the education, and the resources that they can offer. At the end, make sure you use this opportunity to ask questions. So that gives you a chance to find out more about the practice's culture, the patient demographic, and the typical registrar workload and the roster. It also shows that you're interested and have prepared appropriately. So questions you might ask include whether or not the practice has staff or clinical meetings and if they have a regular catch-up after work. If there's anything you said during the interview where they wanted some further clarification, just make sure you send a follow-up to close that loop. Finally, check out GPRA's website for any information.